Hi, I'm Dr. Shamieh. Welcome to the Avala operating room. Let's go take a look inside and see what we do.
It's my house, come on, turn it up.
This is our first operating room. At Disc of Louisiana, we're known for minimally invasive spine surgery. What does that mean? Let's find out. These are the different instruments that we utilize to do our surgeries. They are specific instruments that allow us to make small incisions, not cut any muscle, we don't lose that much blood, we don't give blood transfusions, and we minimize pain and infection rates. I'm standing here in front of our Jackson table. It's a specialized table that allows us to put the patient on the table and shoot X-ray technology through the patient and through the table so that we know where we are in the body. That's one of the key factors to minimally invasive surgery, is that we use X-ray to tell us where we are in the body compared to having an open procedure where you're looking at the body itself and the anatomy inside. On this table, you see these blue wrapped cylinders or boxes. This is all of our equipment. And in order to decrease infection rates and keep things sterile and clean, we have a specialized department that cleans and sterilizes all the equipment and then wraps them in this blue paper. So let's take a look at what's inside.
Welcome to my house, baby, take control now.
These are some of the specialized instruments that we use. These are called pituitary instruments, where you grasp. All of this goes down our tubes, and I'll show you a little bit of that in a second.
Welcome to my house. Welcome to my house. Duck off the crib to spot the pad, but my house is your house.
Okay, so what makes minimally invasive surgery different from open surgery? It's mainly this set, and this is called a flex arm, an arm that attaches to the table, and then we have this contraption which sits on the table and allows our arm to completely be still while we operate on the patient. Once we have the flex arm attached to the bed and we make an incision on the patient, we take this pin under X-ray guidance and we put it to the spot in the spine that we want to operate on. So if I put the pin down to the spine, I use these specialized dilators. Each one is a little bit bigger to put over the pin. Use one that's a little bit bigger. A little bit bigger. Until I get to the desired size. Once we get the biggest dilator in there, then we put a tube over that and attach it to the arm so it doesn't move. So once we have our setup with the arm and the tube, we have to look down the tube. So there's three main ways you can look down the tube. You can just look down there with regular eyesight, but then you have to add a light. The other way is we like to look through something called loupes, L-O-U-P-E-S. These are specialized glasses that when you put them on can magnify 2.5 to 4 times magnification when I look through these lenses right here. So I look down, look through the tube, and operate. But oftentimes we like to use a magnifying microscope. The microscope can magnify things up to 39 times. So you can hear the humming of the microscope. You just bring over the arm. Plus, by utilizing a microscope, I allow my assistant to look through the other lens right here and to help during the surgery. So everything is done through this 18 millimeter diameter hole. I use all my instruments. We have a small curette here. Everything is placed through here and operated on in the spine on the bottom of the tube. Okay? There's different suckers. Everything is specialized so that we can utilize these instruments without our hands getting in the way. You see how they're bent over? I don't want to get into the light, and I don't want to get into the visualization of the tube. One of the main surgeries that we do is a decompression surgery. So if you have a disc herniation that's poking out, pushing on a nerve, we'll use this setup to go in there, and you can tell this bypasses all the skin. The skin is up here. Then you have a lot of tissue and muscle down to the spine, which is down here. If you were to do an open surgery, you'd have to make an incision. You'd have to cut away all the muscle so that you could see down to the spine. But with this way, you skip all that and just operate on the little parts of the spine that are needed to be operated on. So that's a little glimpse of what we do in the operating room. For more information about minimally invasive spine surgery, just go to our website, gospine.com, GEAUXSPINE.com. Thank you.
Welcome to my house, baby. Take